Hi, and welcome to your diabetes education class. This is week 1 of the diabetes education program that you have agreed to do for the next 10 weeks. We would like for you to participate using the Zoom program with the educators and other participants in your class. But for some reason, you weren't able to do that today. So you will be watching this video for your education process for day 1. After this, we ask that you continue to go to your Zoom class and do it with your educator and other participants who are in your class. Thank you for coming today. One of the things up front that we need to discuss is that we need to make sure that anything that occurs in class stays in class. So there are a few ground rules that we have. One of those is confidentiality. So if someone shares something, we don't want you talking about that after class or talking about it with anyone else. Also, we want you to participate in class. There will be different times in class that you may be able to mark something on the screen during the process. We might ask you to give an example of something, and so you might be asked to speak in class a little bit if you're comfortable doing that. But we basically want you to build confidence and be able to manage your diabetes better after finishing this class. My name is Connie Horton, and I've had diabetes for 47 years. I've been a diabetes educator for about 25 years or a little more, and I am married with a daughter in college and a son who is married and in PT school right now. I think we're ready to get started. We are going to be using this book that you should have with you. It's called Type 2 Diabetes Basics, 5th edition. You should bring it with you to every session. We're not going to follow it in exact order because it's divided out into 4 sessions, and we're taking the information and dividing it out into 10 sessions. Each session will be an hour long and will be occurring over the next 10 weeks. You can use this book between sessions to remind you of things that we have discussed. The topics in the book build on each other, so they were reviewed more than once. So you may see stuff repeated in the book as well. We will not follow the book in exact order, so I will tell you when there are certain things you need to fill out in the book and what pages we are on. At the top of the slides, if we're referring to a certain place in the book, the page number in the book will be listed. During this first week, we are going to talk about feelings about diabetes, your support system, what diabetes is, the different types of diabetes, and how type 2 diabetes is diagnosed, what an A1c test is, risk and symptoms, and how to check your blood sugar. So let's get started. First of all, feelings about diabetes. On page 2 in your book are a list of common feelings that people have about diabetes. There are different feelings about having been diagnosed with type 2 diabetes, and those feelings can change over time. Some of you may be newly diagnosed. Some of you may have had diabetes over a period of time and are just now receiving education, or you may have had education in the past and getting more education. But your feelings can change. I don't know if you have feelings that you've experienced in the past or experiencing now. If so, I'd like for you to think about those. Some feelings might be stress, frustrated, guilty, overwhelmed, and fearful. All these feelings are very natural. It's not unusual to have these feelings. If you have these feelings, how we deal with those feelings is important as well. And we will talk about that. We do have our support system. We have our healthcare team as some of our most important support. There are several medical professionals who make up your healthcare team. I would like for you to look over this list of healthcare team members and take note of those that you currently have and know, and those that you might feel that you need in the future. Of course, we all have our primary care doctor. We also have an endocrinologist, which is a doctor who specializes in diabetes. Typically, our physicians will have nurses working with them, a registered nurse. They may also have a registered dietitian who helps with meal planning. Certified diabetes care and education specialists, these may be one of the nurses or dietitian in the group. Behavioral health professionals, pharmacists, social workers, and someone who helps coordinate our care. Let's get talking about what diabetes is. On page 4 in your book, we want to look at how glucose and insulin normally work in a person's body. When we eat, food goes into our system and it breaks down in our stomach and in the gut area into glucose. That glucose goes out into the bloodstream and our blood sugars rise. When our pancreas is working correctly, insulin is produced. Insulin helps move the sugar from the bloodstream into the body cells so it can be used for energy. When we have insulin and the insulin works correctly, insulin allows the glucose to enter, opens up the cell door so the glucose can enter the cell. If insulin doesn't work properly, or if there's not enough insulin, then it's more difficult to move the sugar from the bloodstream into our body cells. And our blood sugar the glucose will stay in our bloodstream and cause our blood sugar levels to be elevated. Diabetes is a chronic disease. Chronic means it's long-term, but it is manageable, and that is so important to remember. We have tools that we can use to manage our diabetes. Some of the causes of diabetes include our muscles are resistant to insulin and glucose can't enter the cells to be used for energy. So sometimes our muscles just don't use the insulin like it should, so the glucose cannot get used up. Insulin deficiency, which is the pancreas makes less insulin. So there's not enough insulin in our body to move the sugar from our bloodstream into our body cells. There's also insulin resistance as caused by extra body fat. Fat cells tend to be more resistant than muscle cells to insulin, therefore making it more difficult to move the glucose into those cells, so the glucose ends up staying in the bloodstream and causing high blood sugars. Also, if we aren't getting glucose into our cells will send a signal to our liver, and our liver will release some glucose that we have stored up. Blood sugars are already elevated, and then more sugar goes into the bloodstream because the cell says it needs sugar to convert to energy for us, and the blood sugar just gets higher and never comes down. All of this leads to diabetes and elevated blood glucose levels. There are many myths and facts about diabetes. We just went over a group of facts about diabetes. There are myths you may have heard of about diabetes too, and I just want to clear a few of those up. At this time, we would normally have you share information about the myths that you've heard of before. But I think I'll just give you some examples of different types of myths. One myth is that anyone on insulin has type 1 diabetes. This is a myth. People who have type 1 diabetes are on insulin, but people who have type 2 diabetes might be on insulin as well. Myth number 2. If you need insulin, your diabetes is worse than someone who needs pills. No, it's just how your diabetes is controlled. It doesn't mean your diabetes is any worse than someone else's. Myth 3. All people with diabetes need insulin. This isn't true either. Some people can control their blood sugars with oral medications, and some people even just with meal plan and exercise. Eating too much sugar or sweets causes diabetes. That's another myth. This is not true either. Eating too much sugar or sweets can cause you to be overweight and store more fat, and fat, of course, is more resistant to insulin, but this is not a fact. It is a myth that eating too much sugar or sweets causes diabetes. Being overweight causes diabetes. It might be a contributing factor, but it is not the main reason or the main cause of diabetes. Type 2 diabetes is not as serious as type 1. Both types of diabetes are serious and both need to be controlled and taken care of. There are 2 types of diabetes. One is type 2 diabetes, which is the most common in adults, and the other is type 1 diabetes. Each type occurs for different reasons, but both result in high glucose. No type of diabetes is worse than the other type of diabetes. If you notice in the picture on the slide, type 1 diabetes is represented on the right. The lock has no key. So if this were a lock on the cell door, the key does not open to allow the glucose into the cell. because there's no key available. Insulin is our key, and if there's no insulin available, there's no way that we can open up that cell door to allow the glucose in. Type 2 diabetes, there are keys present, but the keys don't work. The keys do not unlock the door. They don't fit. So in other words, insulin resistance occurs when the insulin cannot fit and open up that lock on the door to allow the glucose in. The treatment goal is to manage glucose levels no matter what type of diabetes someone has. But depending on the type, different treatments may be needed. How is type 2 diabetes diagnosed? On page 7 through 9 in your book, you will notice that tests can be done. An A1c test, a fasting glucose test, a random glucose test, or an oral glucose tolerance test. Any of these tests can be done to determine whether someone has diabetes or not. They all involve a blood test measured in a lab and so require blood draw to be done, or at least a finger stick. The A1c test is what is used most often to monitor how well your glucose is controlled when you have diabetes. It can also be used to diagnose diabetes. At the time of diagnosis, if an A1c is 6.5% or higher, you would be diagnosed with diabetes. If a blood sugar fasting, meaning you haven't eaten for about 8 hours and you have a blood sugar drawn and it's over 126 or higher, it is an indication that you have diabetes. A random blood sugar 200 milligrams or higher with symptoms is also conclusive to diabetes. Or an oral glucose tolerance test that's over 200 or higher is also signifies the diagnosis of diabetes. And on that random test, that just means you just periodically, sometime during the day, checked your blood sugar, it's over 200, but you also have to have symptoms with a blood sugar over 200 in order to be confirmed with having diabetes. And we'll talk about the symptoms of diabetes in a minute. Let's talk about the A1c test just a little bit more. It represents an average glucose over the past 2 to 3 months. Your red blood cells live in your system for about 2 to 3 months, then our body replaces them and we get new ones. So they're looking at how much glucose is coating those red blood cells. So in our bloodstream are red blood cells. The more glucose that's in the bloodstream, the more coating will be on those red blood cells. If you notice here in the middle, we have someone whose A1c is a low number. So they have glucose coating the red blood cell because our bodies are going to have glucose in them. And we're going to be utilizing our glucose. But there will be some that sticks to the red blood cells. Compared to someone with a high A1c number, they are going to have a lot of glucose coating the red blood cells. And the more glucose that coats the red blood cell, the higher the number is going to be. To make it a little simpler, it's just looking at some donuts here. Those who have sprinkles on them tend to be a lower A1c number than one that would have a whole sugar glaze on it plus some icing on it. That's a lot of sugar. So if we were looking at something like a donut, the donut with the sugar glaze is going to be a higher glucose than those with sugar sprinkles. Lightly coated sugar donuts versus a heavenly glazed donut. Just looking at the amount of sugar on both of them. You had an A1c test done to enroll in the program and should have gotten the results. It is important to know your A1c level. Your A1c shows what your average daily glucose reading has been when checking your blood glucose. You don't have to share with the group, but it's important that you know what your blood sugar level is, your A1c level. If you don't know, please let your teacher, your diabetes educator that teaches you class in your Zoom class, ask them. Tell them you do not know what it is, and that way they can get that information for you. Keep in mind, your target may change over a period of time. You should know what your target goal is by having discussed this with your physician. The American Diabetes Association recommends keeping A1c below 7%. But if you started off with an A1c of 14%, your doctor may say, let's get you down to 10% for your goal right now. Then we'll get it down to 8%, then down to 7%. So it may take a few months to get your blood sugar back down where it needs to be. But this blood sugar test is usually done every 3 to 6 months. And eventually, our final goal should be keeping that A1c blood glucose result less than 7%. On page 10 through 12 in your book talks about risk factors and symptoms of diabetes. There are different risk factors that make you more at risk for developing type 2 diabetes. And if you're looking at page 10 in your book, some of those risk factors include being overweight or obese, not physically active, having a family history of any of the problem like diabetes in your family, if you've had high blood pressure, if you had gestational diabetes, if you're over 45 years old. So there's a whole list on page 10 in your book. I'd like you to turn to page 10 in your book and mark which risk factors you have. I'll give you a couple minutes to do that. Now circle the risk factors that you can change. Some are controllable risk factors and some are uncontrollable. If you have control over the risk factor, I'd like for you to circle those and think about these things when setting your goals in a few weeks. Can we change being overweight? Possibly. That is a changeable goal. Can we change our physical activity if we're not physically active? Yes, we can change that. Can we change being older than 45? No. Can't change our age. We can't change our nationality either if we're Black, African, American, Hispanic, Latino, Asian, Native Hawaiian, or Pacific Islander, Native American, or Alaskan Native. We can't change that. So that's a non-controllable thing. You can't change if you have dark velvety patches of skin on the back, neck, or armpit areas. So there are some things we can change and some things we can't. Your family's risk of diabetes. What are some activities you can do as a family for a healthier lifestyle? And how can you help to decrease the risk of them developing diabetes? It is good to write some of these down in your book on page 11. Some ideas might include biking, hiking, walking, maybe doing some type of cooking classes at home or exercise classes at home, swimming, going to the gym, cooking meals together, planning meals together, or just having better communication and discussing how you can be a healthier family. There are some symptoms of diabetes as well. Most people have had at some point or can identify some of the symptoms of diabetes. Some common symptoms are excessive thirst, increased urination, tiredness, blurry vision, cuts that don't heal, dry itchy skin, infections, numbness or tingling in your hands or your feet. When your blood sugars are elevated, these are symptoms that you can experience, especially if the blood sugar stays elevated for a period of time. These symptoms are caused by too much glucose in your bloodstream, and they usually improve and go away once glucose levels improve. The goal of the Diabetes Care Plan is to keep your glucose levels in target, balance your diabetes with your daily life, feel confident in your ability to manage your diabetes, feel better if you have symptoms of diabetes, prevent, delay, or slow progression of health problems that can be caused by elevated blood glucose levels, and keeping your blood pressure in target levels. Some people, if you notice at the top of this slide, may do that just with food and activity. Some people, the next level down, may need food and activity and an oral medication or more than one oral medication. The next level down, someone may need food and activity, diabetes pills, and possibly non-insulin injectable medications. If that still doesn't control the blood sugars, then food and activity, diabetes pills, possibly insulin, and then last but not least, food and activity, diabetes pills, non-insulin injectable medicines, and insulin injectable medicine. So, there are many ways to control diabetes, and we have so many more resources and ways of controlling diabetes than we did years ago. All people need food and exercise to control their diabetes. So in this 10-week course, we're going to focus a lot on food and exercise. We'll talk on the other things as well, but we're going to focus mostly on food and exercise because it's important for everyone who has diabetes. Let's talk about checking your blood sugar. On page 16 in your book, checking your glucose will help determine if your care plan is working. It'll help you stay healthy and lower your risk of developing complications. Only if you use the results and take action to keep your blood glucose in target range. So we have to use our results to make changes in our treatment plan. I'm assuming all of you are checking your blood sugars right now. You were trained initially before classes actually started. And by checking your blood sugar, you stay more healthy, you lower your risk of developing complication, and if you use the results, it can help. Hopefully you're checking your blood sugar and hopefully you know your glucose target range. If not, we're going to review those soon. If you're having difficulty checking blood sugar, I just want to remind you there is a video on the YouTube on your iPad to help you on how to use your meter. Also, there is a 1-800 number on the back of the meter that you can call to receive help. If you're still having difficulty using your meter, please let your diabetes educator know at your next Zoom class, and when you tell them you're having difficulty, they can stay with you at the end of that class to help you learn how to check your blood sugar using your meter. Besides using a meter to test your blood sugar, becoming even more popular and providing more information are continuous glucose monitors. Basically, with a continuous glucose monitor, you wear a device for typically a week to 2 weeks, and it records your glucose values. Your insurance may pay for this device. If you're interested, you should talk to your healthcare provider. The picture underneath the monitor up there shows someone who has a little patch on their arm, and then that patch is reading to their handheld device what the blood sugar is right now, so it can be checked often. Also, disposing properly of your Lancets is very important. Please see the handout in your packet over how to dispose of Sharps. What I will remind you of is that your Sharp container should be made of heavy-duty plastic, have a tight-fitting lid, usually a screw-on lid, can stay upright, doesn't lead, and also usually it's a solid colored container with a screw-on or tightly fitting lid. On the right-hand side of your handout, you'll notice things you should not use. Put an X through those to remind you should not use them. You can find out from your waste management group in your area how you should dispose of those Sharps in the container. Some of them will have you put them directly in the trash can. Some of them have you bring them to a certain location and have you dispose of them in that location. You can also check the Coalition for the Safe Community Needle Disposal. There's a 1-800 number at the bottom of this page for that. When should you check your blood sugar? We'd like for you for this study to test in the morning before a meal, which is fasting, which means you haven't eaten anything in about probably 6 to 8 hours. After the start of the biggest meal of the day, usually that's going to be 1 or 2 hours after you start eating that meal. If you feel funny or unusual, you should check to make sure your blood sugar is okay. And basically, whenever your healthcare team recommends for you to test your blood sugar. There are different recommendations. In the book, it recommends testing fasting, before the largest meal of the day, and 1 to 2 hours after that meal. For this study, you have enough strips to test twice daily. With this consideration, we would recommend testing fasting and 2 hours after the largest meal of the day. It's a good idea to check anytime you feel funny, though, and you might need to check more often or less depending on how well your blood sugar levels are controlled. For the next week, you'll be using your record book. On the right-hand side of this slide shows the picture of the record book that you should have in your packet. Open it up to the page that has the pills or non-insulin injectable on top of the page and insulin on the bottom of the page. You should put the date, the glucose reading, and time and any notes in that area on the book. What should our targets be for blood glucose levels? On page 16 in your book, it shows what blood sugar levels should be fasting and before a meal, or 1 to 2 hours after the start of the meal. 1 to 2 hours after the start of the meal, it should be less than 180. The American Diabetes Association says 80 to 130 fasting and before meals. Your book says 70 to 130. This is to prevent your blood sugar from going too low. However, low blood sugar is less than 70, so blood sugars between 70 and 79 are also normal. Your glucose targets may look different, depending on what your provider has informed you they should be. Once again, if your blood sugar started off super high, your blood sugar targets may be a little different, but eventually we want to get them down to what the American Diabetes Association recommends, which is 80 to 30 before meals and less than 180 after an hour to 2 hours after the start of a meal. Note, not all of your blood sugars need to fall into this range to achieve your A1c target of 7%. You want at least more than half to be in range. On page 19 in your book, there's an area for you to fill out about how you feel about checking your blood glucose and any concerns you might have. Before next week, I would recommend filling that out on page 19. Let's talk about one more thing, low blood sugar symptoms. Symptoms of low blood sugar can occur when our blood sugar drops less than 70. Symptoms usually include headache, sweaty, shaky, hungry, confused, dizzy, grumpy, fast heartbeat. All these things can signify that you may have a low blood sugar. If you feel symptoms of low blood sugar, you want to test your blood sugar. If it's less than 70, you want to eat 15 grams of carbohydrate. A list of those things are on page 49 in your book. Recheck your blood sugar in 15 minutes after you've eaten something, and then repeat if needed. Some of those things listed on page 49 in your book are half a cup of fruit juice or regular soda pop, a cup of milk, 3 to 4 glucose tablets, or 3 to 4 hard candies. Those are some of the best things to treat low blood sugar with. If you have to treat it more than 3 times in one session, you should let your doctor know that you've had to do that. That's all for Class 1. Thank you, and I'm glad you listened in today. For next week, you want to fill out pages 11 and 19 in your book. If you need help with checking your blood glucose, please go to the YouTube channel that's on your iPad or call the 1-800 number on the back of your meter. If you still have difficulty, your educator will help you after Class 3. Next week, you need to bring your Type 2 Diabetes Basic book, a plate from your cabinet, and the envelope from Session 2, which has Eating for Better Health pamphlet, a 9-inch paper plate, food models, and grocery store layout. Remember, we're not following the book exactly, so only fill out your medication card and questions on 11 and 19. Have a good day.